Thank you, everybody, for joining us for this Zoom about skin wellness. I am Lana Hawayek. I'm a dermatologist. I have put together a PowerPoint presentation. The title of the presentation is Overall Skin Wellness and Tips on How to Delay Skin Aging. I'm glad that we don't have Zoom fatigue by now. I know I've done a ton of Zoom this last year, so I'm glad everybody could join me today for this. First, I thought I'd tell you a little bit about myself. Of course, I graduated with a medical degree from AUB, and then I became board certified in dermatology in 2005. In the US. After that, I got a fellowship in cosmetic surgery and laser from the University of California in San Francisco. After that, I went back to Cincinnati. I joined faculty at the University of Cincinnati, where I worked as assistant professor for about 4 years, where I had an academic a title, and I taught residents, and I also had a private clinic where I saw patients and where I started a brand new surgical cosmetic surgery center from scratch in Cincinnati. After that, I moved to Houston and I joined Memorial Clinical Associates in Houston, where I worked in cosmetic and general and surgical dermatology for also about 4 years until I moved my practice to the Woodlands, which is where we live. And I joined Kelsey-Seybold Clinic. I've been with them for the last 7 years. So when I was asked to give this presentation, I actually thought a lot about what should I talk about, because dermatology is such a big topic with a lot of information. So I thought to myself, what are some of the most common questions people ask? So I'm going to discuss the common questions that I get asked by patients. I'm going to throw in some common skin issues that I see a lot of in clinic. And I thought it'd be interesting to put in some possible quick fixes. By quick fixes, I mean maybe some over-the-counter medications that you can use to try to help the situation before you have to see a dermatologist. And then I'm also going to talk about delaying the aging process. So some of the most common patient complaints and questions, I made a list, and this is by no means, a full list of questions that I get, but the most common, which are dry skin, eczema, which is a continuation of dry skin, oily skin, acne, large pores, brown spots, hair loss, wrinkles, saggy skin, leg veins, and the list goes on and on and on. By the way, before I continue, I forgot to say, if anybody has any questions about the presentation, please type them in the chat area in Zoom, and we'll try to get to them at the end of the presentation, if you don't mind. So first of all, dry skin. And why did I start with dry skin? Because literally every patient that comes in complains of dry skin, or if they don't complain, I find out that they have dry skin. And why is dry skin important? Because it causes itching. So dry skin is actually probably the most common cause of itching, which is a very common symptom that we see in clinic. So more so than treatment, it's important to prevent dry skin. And usually what I tell patients is keep it to 1 shower a day, because some people take 2 or 3 showers a day, which is drying to the skin. So limit to 1 shower a day, keep the shower quick, less than 10 minutes. Use lukewarm water, not too hot, because hot water will dry you out. I recommend using Dove bar soap. There's a Dove for sensitive skin that has no fragrance and is pretty mild on the skin and is not drying. And then once you come out of the shower, you pat dry and you apply moisturizer right after the shower. So that's the trick to seal in the moisture. And the best moisturizer I recommend is plain old Vaseline, the old-fashioned petroleum jelly. Aquaphor is another good one. Some people complain that they're kind of greasy and they don't want them to get on their clothes. So there is a lot of really good moisturizers over the counter. And by the way, I have no conflict of interest. Any name brands or companies or whatever that I mention in this presentation is just to give information. So other moisturizers, CeraVe is a good brand that I like that's over the counter, and Aveeno, of course, is good for dry skin. So as an extension of dry skin, we see a lot of eczema. And I'll tell you, this last year, or 2020 rather, and then going into 2021, we saw a lot of hand dermatitis. And this is kind of a moderate to severe example of hand dermatitis, but you can also have atopic eczema, which comes all over the body. So people were coming in with these really bad cases of hand eczema this year because of all the hand washing that we were doing, hand sanitizers. People were taking maybe longer, hotter showers. And so they come in, the main symptom is itching, but it's also disfiguring. And so the usual common treatment that I give as a prescription will start with topical steroid ointments, and then sometimes they need oral steroids or even other medications that are usually immunosuppressive medications. But what can you do before you get to the dermatologist? There is an over-the-counter topical steroid, which is hydrocortisone, 1%. And I always say, get the ointment rather than the cream, because the ointment's a little bit thicker and greasier and causes more occlusion, so it works better. Most importantly, prevention. So same as what I said with the dry skincare, less than 10-minute showers, lukewarm water, Dove soap, pat dry, apply a moisturizer. And also for hand dermatitis or eczema, always wear gloves when you're doing dishes, even when you're loading the dishwasher, put gloves on. I even put gloves on if I'm cooking. That way it decreases the amount of, or the frequency of hand washing that you have to do. And moisturize. So again, Vaseline is a good one. Neutrogena makes one called Neutrogena Norwegian hand formula, which is very good for hands, but there are many on the market that are tailored specifically for hands. And then there are some that are good for all over the body. Typically, I have a tip that I tell people: get the ones that come in pump bottles. I feel like sometimes it's an extra step to open a jar and take the cream out and put it on, even though the thicker creams are better. But I mean, it's not going to do much difference if it's sitting in a tube or a bottle. So the pump bottles help because they're easy to use, and you can put it outside your shower and or by your sink and use it right after you wash. So next is oily skin. The cause of oily skin is usually mostly genetic. Like if your family has oily skin, you're probably destined to end up with oily skin. But also some other things may play a part. Hormones are one, weather is another. So I have a lot of patients that say, well, my skin got really oily when I moved to Houston. I think it's because of the humidity, and then that leads to acne and other things. So over the counter, what can we get to help with oily skin? Anything with salicylic acid, pretty much. So salicylic acid is basically aspirin in either a liquid form or a wash or a peel or a gel. So for example, Neutrogena makes one called the pink grapefruit wash. They also make a scrub, but I don't recommend scrubs, just the wash. It's about a 0.2% salicylic acid. The reason salicylic works well on oily skin is because the molecule is lipid soluble. It's oil soluble. So you wash your face with it, it's going in the oil glands and cleaning them out from within. In clinic, I do a lot of salicylic acid peels, which are 20 and 30%. It's basically a solution that I put on the patient's skin, usually the face, and then 2 days later they'll peel like they've had a sunburn, and it really helps with oily skin. Clinique and some other over-the-counter products do have some salicylic acid gels that work good for like spot treatment. The next slide is going to be about acne, and that's where those come in. And of course, when you get makeup, you need to get the oil-free, comedogenic, non-comedogenic makeup, which helps with oily skin. So oily skin usually leads to acne. So rarely do you find somebody with acne and dry skin. They usually have oily skin. And so again, salicylic acid wash is something over the counter that you can start with. Benzoyl peroxide is also great for acne. Benzoyl peroxide is an antibacterial agent. I usually keep that a wash for the chest and back, usually for chest and back acne rather than the face. But I do tell people to use a white towel because benzoyl peroxide is bleaching. So you can bleach your colored towels. And then treatment for acne includes something what we call a retinoid, which is usually a topical cream. So the prescription ones are Retin-A and Tazorac. And I'm using the most common names. Of course, there are different brands and generics, and there's many different, but I'm using the ones that most people have heard of. Differin is interesting because Differin used to be prescription and is now over the counter. So you can find Differin 0.1% gel over the counter. So if you have a teenager that's starting to get mild acne, I would suggest to start with, a salicylic acid wash in the morning and then Differin gel at bedtime. And it goes all over the face, and then they can wash it off the next day. After you go see a dermatologist, you will end up on prescription topical or oral medications. Usually those include antibiotics at first. Sometimes we'll do Accutane or isotretinoin. And there are other medications like spironolactone for adult acne, so on and so forth. Peels, like I mentioned, I do a lot of chemical peels. I think I have a picture. Here I am doing a peel. And sure, this is an adult patient, but remember, we see a lot of adult acne as well. So basically the patient lays down. I usually have a fan over their face because it helps with, if they feel any stinging sensation, depending on the peel. Some of them do cause a little tingling. Some of them are completely painless. And I just basically paint the face with this solution, be it salicylic acid, glycolic. I mean, there are so many different kinds of peels. And then we leave the patient for about 10 minutes, and then we wash it off. They go home. 2 days later, they'll peel kind of like they've had a sunburn. Again, it depends on the peel, and I'll talk about some other peels as well. Here's a before and after. Now, she has had several peels, but you can see it's a nice result. It gets rid of the acne as well as the pigmentation, the brown spots that sometimes show up after acne, especially in darker skin. The other complaint I get a lot of is brown spots. I mean, a lot of people come in with brown spots. Why? Because there's so many different kinds of brown spots. I mean, kids come in with freckles, and that's a type of brown spots. Elderly people come in with things that look like freckles that we call solar lentigos, which are freckles, but they're more, they signify more an aging face. You can get brown spots after acne. Like I said, in darker skinned individuals, every single acne lesion can leave a brown spot. And then I see a lot of melasma, which are the bottom two. See, I don't have a pointer, but the bottom two pictures show these well-defined patches. It used to be called the mask of pregnancy. And then after the oral contraceptive pill came out, we started seeing it in women on the pill. And then we even see it in women not on a pill, not pregnant. And then we even see it in about 20% of melasma is in men. So like I said, brown spots, many different reasons. So it's really important to see a dermatologist for brown spots. The most important approach to treatment, I look at it as a 4-stage approach. Number 1 is sunscreen. If somebody is not going to use sunscreen, I almost don't want to treat them because they're not going to get better. So the minute you go out in the sun, things are going to get worse. The second step is a retinoid. Those are the creams that are like Retin-A, Tazorac, tretinoin is the generic. And then over the counter, you can find creams with retinol. So retinol is the over the counter quick fix, so to speak. And there are some brands that are better than others. SkinCeuticals, for example, has a really good retinol. There's a drugstore brand called ROQ, R-O-Q, that has good studies that showed that their retinol is also fine. The third step is hydroquinone, which is a bleaching cream. This is prescription. It used to be over the counter in a 2%, and I think they took it off the market. But we start with the prescription, we start at 4%. And it's kind of a misnomer because it doesn't really bleach the pigment that you already have. It prevents you making pigment. So it's kind of a misnomer. People think that, oh, I have a bleaching cream, I'm gonna spot treat these spots. It doesn't work that way. You have to put it all over for it to work. And then the fourth step is actually chemical peels. So peels are the only thing that mechanically can actually remove the pigment that you have. And like I said, there's so many different peels. We target each peel to the patient, the specific patient, their type of skin, their type of pigmentation, exactly what issue they have. There are several other lightening agents, we call them. The reason I mentioned azelaic acid here is because there is a really good over-the-counter version, which is by a brand called The Ordinary, and it's the 10% azelaic acid suspension. And that works really well because I give it to patients with acne and pigmentation. So like this picture of this lady on the top, well, let's see, left. This is a darker skinned individual with acne that's leaving brown spots. And so the azelaic helps with both. Other lightening agents will include something called kojic acid. You have to be careful with that because if you're allergic to mushrooms, kojic acid comes from mushrooms, yet it is an over-the-counter treatment. So here's another picture of me doing a spot. This is a spot TCA peel. This is for the brown spots that are called seborrheic keratoses. These are different because they're not sunspots. They're actually genetic and we all get them. They used to call them liver spots and people got them on their hands, but sometimes they'll get them on their face and it's kind of like a stuck on lesion. And I do a specific peel for that. It takes about a week to peel off. It looks white when I put the acid on, but then a few days later, it looks dark, like almost like a burn or a cigarette burn kind of, and then it peels off in one piece. Works really well. This is a very common, this is actually a brand name peel, which again, no conflict of interest at all. I just wanted to show you how many different kinds of peels there are. This one is a superficial peel, but it has like many different kinds of peeling agents and it has retinol in it and vitamin C. So it's a really nice peel. It takes about a week for full peeling. This is a very important slide because as I said, with brown spots, I urge everybody to go see a dermatologist first because you don't want to go to a spa and get lasers or peels or whatever treatment they're doing for brown spots without a proper diagnosis. Many times the brown spots are actually bad brown spots. And for example, these are two examples of a type of melanoma called the lentigo maligna melanoma that's just flat and looks pretty indolent and sits on the skin for years sometimes without the patient knowing that it's there. So next I'm going to talk about hair loss. Another thing other than hand eczema that I saw a lot of during this pandemic was hair loss. Now, there are so many different kinds of hair loss, but there's a type that you can get, for example, after you get COVID. So people that got COVID had an illness or fever. You get something called telogen effluvium, which happens about 3 months after the illness. It's kind of the same type of hair loss that pregnant women, you know, when pregnant women have their baby and lose hair 3 to 4 months later. It happens after high fever, surgery sometimes. So that was a common occurrence. Now, the good news about telogen effluvium is that the hair just grows back on its own. So usually we'll give, you know, some over-the-counter supplements and then the hair just grows back on our own. More commonly, what I see is this type of hair loss in the female picture and then the lower right male picture. This is male and female pattern alopecia, which is usually just from aging. And I say usually because for some reason these past 2 weeks, I saw many people in their 20s come in with this type of hair loss as well. But this is called androgenic alopecia, which means almost like where the male hormones kind of affect the skin more than they should. And so with aging, we start seeing this type of diffuse, you know, non-scarring hair loss. The picture on the right upper, the very round hair loss, this is something different. This is alopecia areata, which is autoimmune. This one you can see in kids and adults, very different. I just put the picture just so that, you know, we can see that there's so many different kinds and there are different, you know, there's some systemic conditions that cause hair loss. Lupus can cause hair loss. Thyroid disorders can cause hair loss. I'm not going to talk about everything, but the most common one that I see is this male and female pattern alopecia. And so what do I recommend? Number one, we'll tell people to get an over-the-counter biotin supplement. So you can go and find anything that has biotin. Usually about 2,500 micrograms is the recommended dose. There are a couple of brand names that we find may work better than others. One is called Nutrafol and one is called Viviscal Pro, and you can probably find them on Amazon. Sometimes I have a theory with why things work better. If they're a little bit more expensive, I feel like people end up using them because they've paid for them, and so that could be why they work better, but they seem to do a better job. Another very good treatment is over-the-counter topical minoxidil, or Rogaine. The brand name is called Rogaine. It came out first for men in a 5% and women in a 2%. We found that the 2% doesn't work. So now we recommend that everybody use the 5%. So even if it says men's, women can still use it. You just want to put it on your head and make sure it doesn't get on your face. It comes in a solution and a foam. I like the solution more because I feel like it actually gets into your scalp. I feel like and some people prefer the foam, but I feel like the foam gets stuck in the hair. So it's hard to, and you really don't need it on your hair. You need it to actually get on your scalp. Then I start looking into prescription medication. So spironolactone is one, finasteride is one, which for men used to be called, not used to be, still called Propecia, but which is a 1 milligram dose. Now we're actually giving it off-label for most postmenopausal women in a 5 milligram dose. And there are other new off-label medications that we're using, dutasteride. Basically, most of them kind of fight male hormones in both males and females, basically, or fight the effect of the male hormone on the skin or the hair. Lastly, I do recommend a procedure called PRP, which is platelet-rich plasma. It's a procedure where I draw blood from the patient, and then we centrifuge it and separate the platelets from the rest of the blood. And then you basically inject the scalp with those platelets. So it's a liquid solution filled with platelets. Why platelets? Because they have numerous growth factors. They have like 10 or 12 growth factors, and that stimulates the hair. Now, you have to have a hair follicle. So if somebody has lost their hair, 20 years ago, I wouldn't recommend PRP. But for people like this gentleman down at the bottom, there's a before and after picture. This is several treatments, but it does work well for this type of hair loss. I rarely recommend just PRP. I usually have patients on biotin, on minoxidil, and on a prescription medication at the same time. The injections I usually do once every 4 weeks for about 3 to 5 treatments, and then we go to every 3 months, and then sometimes if people do really well, every 6 months for maintenance. Spider veins, I do a lot of, I see a lot of people for spider veins, basically because I do the procedure, which is sclerotherapy. So spider veins are these red-blue small veins on the lower extremities, usually on the thighs and lower legs. The main reason some people get these is genetic, I think. I mean, it's family history, but weight gain will make them worse. Pregnancy, which because of weight gain will make them worse. So anything that will put pressure on these legs where it becomes difficult for the veins in the legs to pump blood back to your heart, and this blood starts pooling in the legs and you get some swelling, and you may not always get swelling, but you end up getting these unsightly veins. Occupation, so if somebody has a job like mine where I'm standing up all day, higher risk for getting spider veins. So again, I like always to talk about prevention because it's important. Exercise is very important. So running, walking, any kind of exercise that moves those muscles in the legs and the calves pumps the blood out of the legs and helps prevent these veins. Leg elevation. So whenever you're home watching TV, put your legs up. Weight control, again, you put on weight, they get worse. Support stockings are very important. The problem is here in Houston, it's so hot to wear them. So half the year it's too hot to wear them. But if you can, I would wear them. I do try to wear them to work daily. And then no heels, which I don't do. So the gold standard treatment for spider veins, and this has been a board question for dermatology boards for the past, 40 years. It's still sclerotherapy. And sclerotherapy is a procedure where I basically inject these small leg veins with a sclerosant solution. And there are many different kinds of solutions. One used to be hypertonic saline, if you've heard of it, which is like a salt solution. It used to be kind of painful when it goes in. For the last, I would say 15 years, I've been using something called polydocanol, which is pretty painless. So you barely feel the needle. I use tiny needles. So half the work is done when I'm injecting the veins, because you have to get the medication in the veins. And then what I do is I'll put these cotton balls on. My nurse actually helps put them on, and this puts pressure on the veins and it keeps the medication in those veins as long as possible. So you don't want to dilute the medication. You want it to actually sit there and irritate the blood vessel wall, so much so that the body feels that this is an abnormal vein and goes and tries to resorb it or absorb it. So after we do this, the patient actually brings in their support stockings. So they have to put them on 3 days nonstop and then 2 weeks during the day. You do need several treatments. Usually I'll say probably 3 to 5. Now it depends on how many veins the patient has at baseline, but we'll say about 3 to 5 treatments. And then the results are actually really nice. This is several treatments, but this is kind of what to expect. So wrinkles. So I do a lot of cosmetic consults because of my cosmetic surgery fellowship. So there's always good news and bad news with everything. So the bad news is you can go from this lady on the left to look like the lady in the right, on the right picture. But the good news is you can also, nowadays, we have so many different modalities to go back from the lady in the left to the lady in the right picture. I always like to include this saying by Mark Twain: wrinkles should merely indicate where smiles have been. So what is my philosophy of reversing aging? I remember in the beginning, the presentation is called Tips on Delaying Aging, because I don't really believe much in reversing aging. But really, with some of these modalities, you can probably make somebody look about 5 to 10 years younger than their actual age, which is not always a bad thing. So it's the 3 R's: relax, refill, resurface. So let's see what these are. So the first R is relax. And here I'm talking about, again, I'm going to use the brand name Botox, but there are many different botulism toxins that work the same way. Botox is the one that's used the most, and it's the one that I use the most. So Botox is an injectable treatment. When I'm using it, I'm actually injecting the muscle that's under the wrinkle. So it's almost like an accordion. There's a muscle under the wrinkle. So think about your frown lines. There's actually a set of 5 muscles in the frown that when you contract these muscles, you form a frown, and it actually brings down the brows. So it's called a brow depressor. So if you look at this upper left picture, this is before Botox. She's frowning. And then, so we did the injections. And by the way, this isn't my patient. These are stock pictures that I got just because I didn't have time to get approval from my patients. But this is 2 days after. So what it does is it relaxes those muscles. It will temporarily relax, or some people don't like to use the word paralyze, but basically it's relaxing these muscles for 3 months. So if somebody tells you, oh, my Botox lasts a year, I don't think so. Biologically, it's out of your system and out of your muscles in 3 months. 2 weeks is when you get the full effect. So again, if you look at that upper left-hand picture, that's 14 days later. So she's trying to frown, but she can't because those muscles are relaxed. And it does 2 purposes. It gets rid of the wrinkles, but it also raises the brow, which is more important, I think. The upper right hand corner picture is before and after of crow's feet, which are the lines around the eyes. Again, this is about 3 or 4 injections of Botox, very superficial, pretty painless, to tell you the truth. And 2 weeks later, you get full effect. So then you'll try to squint and you won't be able to form that wrinkle. Again, this muscle, think about it like an accordion. So if the accordion underneath the skin is relaxed, then nothing's going to wrinkle the skin on top. We do a lot of Botox for foreheads, like the lower left hand. That's a before and after. So then when you raise your brow, You won't be able to form. This is the accordion is up here. So I don't know if you can see me. I keep making faces and stuff, but I don't know if you guys are looking at me at all. But the muscles in the forehead, again, it's the frontalis, it's like an accordion. So once that's relaxed, there's nothing to raise those brows and form those wrinkles. I am one of the few dermatologists in town that actually do neck Botox, and I do a lot of that. People don't realize that we can actually put Botox in their neck for those neck bands, and you can see it. It's a nice result. Okay, so that was relax. Next is refill. So when I say refill, I mean refill the areas of volume loss. So as we age, we are losing volume. Other than gravity and other issues, we are losing volume in our skin, in the fat under the skin, even in the bone. Even the bone of the face gets resorbed, and so you lose volume there. So when I say refill, we talk about fillers, injectable fillers. They are injections. Most commonly used are something called Juvederm, something called Restylane, which are made of a hyaluronic acid gel. Hyaluronic acid is so safe because it's present in all species and the molecules are the same across species. So there's no allergy to it. Like when we used to do collagen, we would have to test people because some people were allergic to collagen. With Juvederm and Restylane, you don't. So if you look at the upper picture, very subtle, but if you look around her mouth, so this is a younger patient, obviously, she has a little bit of volume loss or lines, the parentheses around the mouth, and you can see that's the before and after. The lower one is a little bit more advanced volume loss, and so you can see it's a nicer result. Obviously, when you have more volume loss, you need more syringes. So this product comes in a pre-packaged sterile syringe. So that's the other nice thing, is you're not having to, for example, when you do liposuction, you remove fat to inject, there's a risk of infection and all that. These are coming ready filled syringes. You do see the result immediately. I always say it looks better a few weeks later because the hyaluronic acids, they attract water. So the more water you drink, the more it kind of plumps up and looks nicer over time. The third R is resurface. Resurface, exactly what it kind of says, resurface. So it's changing the surface of the skin. So like I said, as we age, we get brown spots, we get fine wrinkles, splotches, uneven skin color. Some people look even yellowish from elastosis, we call it, which is long-term sun damage. So resurface means to change the texture, the top layer of the skin. You can achieve that with chemical peels, which I do heavily, and then you can do lasers. More recently, we've been doing microneedling, which is a little bit less invasive. The lasers, for example, like resurfacing lasers, something like CO2 will remove the whole top layer of the skin. Of course, the more invasive the procedure, the more risk of side effects from it. Okay, so after I talked about aging, a very common question that I get is usually at the end of a full skin exam, even if it's just general derm, people will say, well, doc, what products should I really be using on my skin? Because there's so many, advertisements and over the counter. You go to a drugstore or a Sephora or whatever, and you find all these creams. So people don't know, which ones should we really be using? And I usually mention three main product types. Number one, first and foremost, is sunscreen. So if somebody says, well, I want to put one thing on my skin, then it's sunscreen. The second is retinoids. The third is antioxidants. And I will talk briefly about each one. Sunscreen, like I said, is very important. So for years, we've been telling people, sunscreen, very important, prevents skin cancer. Some put it on, some don't put it on. But when you say it prevents aging, most people put it on. So I urge you all to wear your sunscreen. And, when I say sunscreen, I mean sunscreen every day. So put it into your daily routine. You wake up, shower, wash your face, whatever you do in the morning, then put your sunscreen on. Then if you put makeup, the makeup goes on top. So everybody says, well, in what order do I put? Yes, sunscreen goes on first and then makeup. If you're using a medication cream, for example, for acne or for brown spots, then that goes on first. So you always put the medication on clean skin, then the sunscreen, then the makeup. When you're looking for a sunscreen, always make sure that it says broad spectrum. And that's important because they used to make sunscreens that were just for UVB. So UVB is the ultraviolet band that causes the redness, original redness. So that's how they measure SPF. So when we see something that's SPF, for example, 30, that means that's covering UVB. It doesn't mean it covers UVA. And UVA is the longer spectrum. So that causes darkening of the skin, causes skin cancer, etc. So it has to be broad spectrum, UVA, UVB. Some of the newer ones will also say visible light, which is also a plus. Always look for one that says SPF 30 or above. So some people will tell me, Doc, is there really a big difference between 30 and 100? And I'll say, okay, so maybe it's like, it's like the Pfizer and Moderna vaccines. It's 0.5% different. There is some little difference. So in my mind, if you're going to go buy one and they're the same price and there's one that's 100, why not get 100? But is it essential? Probably not. What's more essential is to put it on every day. You have to put the sunscreen on pretty thick for it to work as advertised. What does that mean? Usually when we're putting on sunscreen, we're not putting it the same way they did during the study. So when they did a study and claimed that this sunscreen is an SPF 30, they were putting it on pretty thick. When we put it on for daily use, we're covering about 30% of that number. So if the sunscreen is 30, and you're putting it on normal everyday kind of use, you're getting covered by about an SPF of 10. So if you want to be more careful, then you really want to put it on thickly. And it's very important to reapply sunscreen every 2 hours because sunscreen actually degrades in the sun. So the second thing is retinoids, and I've mentioned them along the way during this presentation because they help with acne, they help with brown spots and pigmentation, they even help with some acne scars, they help with wrinkles. The prescription ones are Retin-A or Tretinoin, Tazorac, Differin. Like I said, Differin, there is one now that's over the counter. It doesn't work as well on wrinkles and brown spots as the other ones, but it does work well on acne. And then again, you can try to find something over the counter with retinol that will help with fine wrinkles. And that's the retinoid. Oh, retinoids go on all over. So again, not spot treatment and always at night because they do degrade in the sun. So you don't want to put it on in the morning and go outside because it won't work. So you put it on at night, you wash it off in the morning. And you always use a sunscreen if you're using a retinoid. Another question I get a lot, oh, it's summer, I can't use a retinoid. Yes, you can, you just need to use a sunscreen with it. The third category were antioxidants. So this is like the third on my list, but antioxidants are interesting things because they are actually substances that protect your skin from the damaging free radicals that happen as a result of environmental effects. So what are the environmental effects? One is UV radiation, one is pollution, one is smoking, personal smoking, or what is it called? Passive smoking. Some people think stress causes higher free radicals. Other things, some drugs, medications cause things like this. So that's where antioxidants come in. There are 3 different types of antioxidants. There are some that are made in your skin, the most common being vitamin E and vitamin C. So those are in your skin, your body is making them. There are some that you get from food, and there are some that are synthetic or man-made. So obviously you can take vitamin C by mouth in a pill form, or vitamin E or beta carotene, lots of different ones on the market. What foods are rich in antioxidants? Also many, the main ones that caught my eye are dark chocolate, berries, all kinds of berries. So strawberries, blueberries, blackberries, pecans, goji berries, spinach and kale, artichoke, beans, beets. Salmon is a big one for antioxidants, and so forth. And so why are they important? Because they help reverse the damage that we're getting from the environment, which causes aging, and it causes skin cancer eventually as well. So in conclusion, I wanted to put in this quote I like from Eleanor Roosevelt. Beautiful people are accidents of nature. Sorry, beautiful young people are accidents of nature, but beautiful old people are works of art. And I will conclude, and thank you for listening. And I can now take some questions.
All right, Dr. Hawayek, there we have a couple of questions here. One of them says, can you share the basics of daily skincare routine if you haven't already done with your last slides? I guess if there's anything else to add.
Yeah, so like I said, I mean, okay, so they tell you, can we sleep with makeup on? I didn't really touch on these things. Always, wash your face. If you have makeup on during the day, or even honestly, men, even people that are not washing their face at night, I think it's quite important because it cleans out the oils that are, or excessive pollutants from the day. So I think it's important to wash your face at night. Put on your retinol or retinoid. If you have a prescription strength, it's always better. But like I said, you can find the retinol over the counter. Next day in the morning, wash. So when you're washing more than once, you don't want to use a harsh wash. So for example, when I said the salicylic acid wash, if you use it twice a day, you might dry out your skin, even if you're oily. So then I usually recommend, using it one time. And then the second time, just use like a bar soap of Dove soap, which is mild. And then you put on, like I said, if you have a prescription or if you're going to do an antioxidant, then you do it in the morning. So vitamin C, for example, there's like a 20% vitamin C by Obagi. There's some other brands that make a Revision, make a good one. You put it on in the morning, then you put your sunscreen, then you put your makeup if you're going to wear makeup.
All right, well, that's good. The second question is biotin safe for kids? Can it be used as a preventative for kids who have parents with who have very thin hair?
So I'll tell you that. So it's a very intricate story with biotin, because if you look through the literature, there are no studies that show for sure that biotin works for hair loss. Okay, it's all anecdotal. So we try it. Do I give it to kids? No, but the way they thought about biotin helping in adult hair loss is because kids that are born deficient of biotin have no hair. So this was how originally they thought about biotin for hair loss. It's probably safe, but I mean, I wouldn't give it as preventative because there is no proof that it actually will work that way. There are no studies that have shown that.
I see. Also, there's you talked about sunscreen and all that, and there's a question about moisturizers
What about the moisturizer that
have SPF in them?
Again, honestly, sometimes it depends on the brand. So if it's a brand I know that makes good sunscreens and then they have a moisturizer that has some SPF, then yes, maybe. Usually these moisturizers have an SPF of 15. So I prefer something that's actually labeled as a sunscreen that has an SPF of 30 or above, that's broad spectrum, covers UVA, UVB. Usually it's also moisturizing at the same time. Like for example, I use a brand called Elta MD, and they have an excellent sunscreen that's actually made, one of the products is the Clear, which is made for acne prone skin, oily skin, people with rosacea, because it tones down redness, it prevents acne. And for me, it's enough as a moisturizer, and they don't advertise it as a moisturizer. It's purely a sunscreen. So usually a sunscreen is okay to use as a moisturizer, but if something is purely a moisturizer with a little bit of SPF, I prefer to put something else underneath.
All right, and we have a question, maybe I think this is probably the last question here. What is the best non-surgical solution to saggy double chin?
So saggy is one thing and double chin is something. So I'll start with double chin because I do a procedure called Kybella, which is an injectable solution for double chin. So when somebody has the fat, it's more for the fat deposit under the chin, which is what ends up looking like a double chin. Kybella is deoxycholic acid. So it's the stuff that comes out of your gallbladder, basically. Of course, they made it synthetically for an injection. and we inject it in the fat under the chin. It dissolves the fat and permanent. So whatever is gone permanently. Now you do need several sessions. Of course, all of these procedures are out of pocket. They're not covered by insurance, but that's the procedure. Now, what's important for this procedure is to pick the patient. So you don't want to pick a patient that's like maybe older, like let's say older than 80 with saggy skin. So that's the trick, is you need to pick somebody who's younger and has this fullness, where when you inject, you're going to get rid of the fat, but you want the skin to spring back. If that makes sense, to, pull back. You don't want to end up with loose, excessive skin, because then it's going to look worse. So to answer the question in a different way, people with saggy skin in that area would benefit more from like a neck lift. And sometimes the plastic surgeon will do like a lipo and then a neck lift, or just a neck lift or something like that. But the ideal patient for Kybella has the taut skin. You need to have a good elastic tissue and collagen in your skin so that it bounces back.
All right, well, I think that's about it. No more questions here. Well, actually, there's one. What to do for sunken eyes with darker skin in a non-smoker, started at age 45?
So again, different things, but so there's the sunken, which is the volume loss, and then there's darkening. So sometimes it's not really darkening. Sometimes people think that they have the darkening under their eyes, but it looks worse because of the sunken nature. So it's multifactorial. If somebody really does have darkening, that's usually mostly genetic. Another reason is volume loss. Thirdly, so what happens is you get volume loss, so the blood vessels that are underneath the eyes show up more, so it looks darker. So it's very important to see somebody who actually knows how to diagnose this, because if it's just the volume loss, then we do filler. So you fill with, Juvederm hyaluronic acid or whatever. People that do fat transfer can put some fat in there to plump it up, and then the pigment, it won't look dark. But if there's actual pigment, then you have to look into chemical peels, creams, hydroquinone, which is a bleaching cream. Some people do lasers and etc. Difficult area to treat, but it really needs a good diagnostician first to really, find out where the issue is. I can't hear you, Mana. What about anti-aging serum?
Serum, yeah, in skin.
Anti-aging is the big umbrella. So kind of what I talked about, the different components of these serums. So the serum usually should have either a retinol or a retinol and an antioxidant. So, and there are so many different kinds of antioxidants. I mentioned the most common ones, like the vitamin E, the vitamin C, but there are other ones. Selenium is even an antioxidant. So you have to look at the ingredients, but those are the main ones. Vitamin C helps with pigmentation. So that one I really like, and that's why I said you use it in the morning. Anything with retinol is good, and you put it on at night. So retinol and retinoids also stimulate collagen production. So there were studies where they did biopsies before and after, and they showed thicker collagen, which is always a good thing because that helps with wrinkles. So when you say anti-aging serum, it's kind of like the broad term, and underneath and sometimes you have to do more than one serum to get all these products on your face. But like I said, the most important is sunscreen. Second is anything with a retinoid. And third is anything with an antioxidant. SkinCeuticals, incidentally, makes one called CE ferulic, which is an excellent antioxidant. Now, that is for drier skin. So they recently came up with one, I think it's called Silymarin, and it has salicylic acid. That's the one that I like for oily skin. But they're antioxidants, but one makes the skin oilier than the other. You're welcome.
Well, thank you very much. I think that is all for now, and that was a wonderful presentation, very informative. And
Thank you. I hope you liked it. I put a lot of information in a small amount of time, so hopefully I got my message across.
great session.
Thank you for
so much.
having me.
It was a pleasure.